73-year-old Viola Simmons was brought into the emergency department. Social workers were alarmed as she appeared to be a victim of neglect, dirty, frail, and unkempt. Although the social workers tried to remove Ms. Simmons from her daughter's care, she refused to have her mother moved into a long-term care home. The elderly woman and her daughter then seemed to disappear. 3 years later, Ms. Simmons showed up in emergency again, completely emaciated and covered in dried vomit and bruises. Records indicated that none of her prescriptions had been filled for up to 2 years. Ms. Simmons was eventually moved to a long-term care facility, but never recovered from her injuries and remained too sick to have her fractured hip repaired. She died months later. As we have paused to remember in particular, the 14 young women who were murdered at L'École Polytechnique, I'd like us to pause to remember Viola Simmons and all older women who've lost their lives to interpersonal violence and abuse. In order to understand violence against older women, it's important to understand some of the context within which it is occurring. One of the most distinctive or distinguishing trends of the 20th century was the aging population globally. And the UN Population Fund has said this is a trend that is dramatically changing economies and societies around the world. The number of people age 60 plus is expected to reach 1.4 billion by 2030, and 20 years later, projected to be 2.1 billion. The global life expectancy at birth was 68.6 years in 2015. This will be 76.2 years in 2050. And the population is aging similarly in Canada. In fact, Statistics Canada said that in 2015, for the first time ever, there were more older adults aged 65 plus than children aged 0 to 14 years in Canada. And the majority of the older population is and will continue to be women. Worldwide, according to the United Nations, older women will continue to outnumber men due to longer life expectancies, so that current statistics show that for every 100 women aged 60 plus, there are 86 men, and for every 100 women 80 plus, only 63 men. In Canada, in 2016, Statistics Canada reported that women also make up the majority of the older adult population, 53% of the population aged 60 plus, and 61% of the population aged 80 plus. Stereotypes concerning old age exist across cultures. There is plenty of evidence to show this. And as the population ages, many are worried, concerned that work in this field that more people will experience discrimination based on ageist beliefs and practices. In a relatively recent research report by Rivera Canada, 63% of Canadians aged 66 plus indicated that they had been treated unfairly or differently because of their age. And older women face double discrimination on the basis of both gender and age, so that many older women are plunged into poverty and otherwise marginalized at a time when they are very vulnerable. Ageism and sexism also interact with other lived experiences. Women are not a homogeneous group, and we need to remember that. Different sets of identities impact experiences of violence, prevalence or risk of being targeted for abuse, and one's experience with systems and services. Sapali Garouge and colleague at Ryerson University, who've conducted a considerable amount of research on abuse in the post-migration context, has commented, for example, that while both immigrant and non-immigrant elders experience ageism, for older immigrant women, convergence of multiple isms of oppression, including ageism, sexism, racism, and classism, have made older immigrant women from racialized communities invisible to society. All of these factors contribute to this phenomenon known most commonly as elder abuse, which in recent years has been acknowledged to be a global public health and human rights problem. The World Health Organization defines the abuse of older adults as a single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust that causes harm or distress to an older person. and it includes physical abuse, psychological abuse, sexual abuse, among other forms of abuse. But this definition, which is the most commonly used globally, has been criticized, both for being very broad. It includes, for example, single and ongoing victimizations, and being very narrow at the same time, as it's centered on an expectation of trust. And the problem with that, many feel, is that it excludes, therefore, victimization by strangers, which include many cases of financial abuse, and also this growing phenomenon of resident-on-resident abuse. Canadian definitions of elder abuse actually vary from jurisdiction to jurisdiction, but some are broader than the original WHO definition. Here, Department of Justice Canada also includes older adults that are abused by non-family members who are not in a position of power or trust. And that's important because then incorporated into this definition de facto is abuse by a resident, let's say in a retirement home or care facility, as well as abuse perpetrated by strangers. The problem is with all of these existing definitions is that they clump men and women together as older adults instead of applying a sex or gendered lens. And the real impact of that is that older women's unique experiences of violence are often overlooked or misunderstood. Elder abuse responses, therefore, are often inadequate because they don't meet the specific needs of older women. So the World Bank and other international collaborators have proposed an alternative definition of violence against older women. They've lowered the threshold to women aged 50 and older, and it includes any act of gender-based violence that results in or is likely to result in physical, sexual, or mental harm or suffering. Unfortunately, this definition is not implemented widely. And until it is, we have a limited picture of what violence against older women really looks like, but there is a picture, both generally of elder abuse and more specifically of violence against older women in terms of prevalence, perpetrators, risk factors, consequences, and help seeking. And I'm going to share some of that data with you now. I just want to point out that you have to be cautious comparing across studies, which many people do, because the studies actually vary methodologically. So what do we know? We know that elder abuse is prevalent globally. In a review of studies internationally, the prevalence of elder abuse actually ranged from 1.1% in the United States to 44.6% in Spain. A later study, a systematic review of 18 population-based studies that were considered more rigorous and similar in methodology, found that one-year rates ranged from, for physical abuse, 0.2 to 4.9%, emotional abuse, for example, 0.7 to 6.3%, but the threshold was very high in order to meet emotional abuse, so that the respondent actually had to have experienced 10 or more events in the past year. And the most common type of abuse across these international studies was financial abuse. We know that elder abuse is common and may be increasing in Canada. A recent telephone survey of Canadians 55 plus conducted by Lynn MacDonald at the University of Toronto found that 8.2% of respondents had experienced any abuse or neglect. And again, the most common types of abuse were psychological, emotional, and financial abuse. There'll be much more data forthcoming from this large study, but the media was quick to jump on these figures and show concern. City News wrote, more than 750,000 Canadian seniors suffered some form of abuse last year, be it physical, sexual, psychological, or financial abuse and neglect. And that is more than double since a similar study was done back in 1989. And I just want to stop and say that that 1989 study was groundbreaking. It was the first national study on elder abuse in Canada, perhaps even globally, and it was led by Elizabeth Podniaks, who is here today. We're very honored to have had her as a Rose holder. So there is some evidence to suggest, too, that older women in Canada are at a greater risk than men of family-related violence. In recent Statistics Canada reports of police-reported rates of family violence for older women. They were 26% higher than the rate for older men. And this carried through to the following year, 2014, as well. Likewise, there's some evidence to suggest that older women are more likely to be abused by intimate partners and grown children than men. So Statistics Canada has presented the information for victimized Canadians aged 65 to 89 years, and abuse by an intimate partner was reported by 15% of women versus 5% of men. And just overall, too, you can see, I've circled it on the slide, that older women are most commonly abused by a spouse. And this really isn't surprising. We know this is the most common type of abuse globally, is intimate partner abuse, and it may carry on from a younger age into older age, and we see that reflected perhaps here. So there is much evidence to show the links between elder abuse and harmful consequences for both women and men. Elder abuse has been found to be associated with chronic health problems of various kinds, emotional distress, including depression and anxiety, a loss of financial resources, increased rates of emergency department use, admission to nursing facilities, and hospitalization, to name a few consequences, and also immediate physical injuries. And some types of elder abuse are more common among women and may be particularly violent and lead to particularly serious harms. And this quote is representative of that. This is a 63-year-old woman who was in a study on domestic abuse among older people. She recounted, "My husband was extremely abusive and he put me into the hospital quite a few times. I have had major bone problems and I had to have an operation on my spine, and I'm questioning whether that has to do with the beatings. I've got arthritis and I had a lot of broken bones when he was doing this. I'm sure that this possibly did impact upon me now. I can hardly walk and I have to go into a wheelchair to go about." Unfortunately, few abused older women seek help from formal support providers. This was a large study conducted in Europe across 5 different countries, and they found that overall less than 1 in 5 women, older women who'd been abused, had reported the most serious incident to any type of formal institution. And when they looked at support from a healthcare provider, only 6.5% had sought support for a healthcare provider and 4.8% from police. So a lot of lost opportunity to help older women in their recovery and to prevent further re-victimizations. The good news is, because I like to end on good news, is that there has been a global call to action to address and better understand violence against older women. The United Nations has declaratively stated that it needs to be made visible and made to end. And for example, they've held 2 large global meetings recently, the UN Commission on the Status of Women. One in March 2016 focused on ending elder abuse and breaking the generational cycle of violence, in which they discussed the oversight of older women in achieving gender equality, which is absolutely necessary to ending violence against women for women of any age in the Millennium Development Goals, and how to empower all women and girls, not just those of reproductive age. A second meeting, actually it was the first meeting, was Older Women Count, bringing visibility to violence against older women 20 years after Beijing. And again, global experts discussed how countries need to address challenges faced by older women experiencing violence. Both meetings were broadcast on UN Web TV and are available to the global public and to policymakers. Both those important meetings actually built on the UN Department of Economic and Social Affairs 2013 expert group meeting. And this meeting focused on current research, data, terminology, and frameworks that are used to describe and classify violence and abuse against older women, and assessed approaches to intervention and prevention. And they acknowledged pretty much the complete failure of the Madrid International Plan of Action on Aging to eliminate all forms of neglect, abuse, and violence against older persons. And they also interestingly pointed out that there's been numerous campaigns by UN Women initiated to end violence against women, and these campaigns have made no mention of older women as a vulnerable group. So that important UN DESA meeting resulted in the report, Neglect, Abuse, and Violence Against Older Women. And it contains important recommendations to ensure older women are included in the UN's ongoing work and efforts to end violence and abuse globally. Some of the recommendations were to clarify definitions and measurement tools. You've seen that's quite a problem. Collect more data on the prevalence, but importantly on evidence-based practices for prevention of and intervention in cases of violence against older women. They called for us to undertake a review of legislation and laws related to the issue and their implications, and to identify unifying themes, connect older women in developing and industrialized countries, but as well connect girls and women of all ages. At the same time, there have been many international consortiums and groups that have stressed the importance of the health sector collaborating with other sectors to address the abuse of older women. And a number of recommendations have been made. I've highlighted a few here. For example, to develop greater capacity of healthcare providers, but also social workers, shelters, police, etc., to better identify and respond to violence, abuse, and neglect of older women. To train service providers, all of those service providers, on effective, sympathetic, appropriate ways to support older survivors. And I know we have Maureen Etkin here from Elder Abuse Ontario. They already do a lot of really fabulous work related to that. Involve older women in the development of policies and programs that support, protect, and enhance their rights, and implement policies that enforce equitable access to wide-ranging health services that do not discriminate on the basis of older age. And one of the most widespread and maybe widely accepted recommendations has been around establishing multidisciplinary teams and intersectoral collaborations to coordinate all available services. And consistent with that recommendation, I've actually been working with the Ontario Network of Sexual Assault and Domestic Violence Treatment Centres and other organizations like Elder Abuse Ontario to develop a model, comprehensive and interdisciplinary elder abuse intervention for Ontario. So this intervention would build on the existing infrastructure of the Sexual Assault and Domestic Violence Treatment Centres that provide sexual assault and domestic violence services. It would have formalized links to the allied health, community and legal sectors. It would be guided by a social inclusion framework and would address the complex functional, social, forensic, and medical needs of abused older women and men. There are also opportunities for the consideration of elder abuse within multidisciplinary health services more generally focused on older adults. For example, and there are other examples at Women's College Hospital, the innovative Elder Care Program. It provides comprehensive multidisciplinary care to patients aged 80+ with chronic conditions, the majority of whom seen are women, and includes physicians, nurses, pharmacists, researchers, a dietitian, and a community care access coordinator. And multidisciplinary services such as these really hold promise for better outcomes for older women who've experienced abuse. As represented in the story of Georgette. Georgette came to the shelter after her daughter's initial inquiry to the shelter. She was extremely anxious when she arrived, worried about the mental state of her husband, who had threatened to kill her on numerous occasions. In recent years, her husband of 42 years started drinking a lot and had become obsessive, constantly asking her where she was going, accusing her of adultery, and following her. Over time, Georgette had become isolated, powerless, and fearful. With the support of Transition House staff, Georgette decided to divorce her husband. Staff supported her through the divorce. She was able to get back some of her personal belongings, utilizing police accompaniment. 10 months after arriving at the Transition House, Georgette got her divorce and was able to move back into her home. She is now working in a pastry shop. Thank you.